Arthritis is from the root word arthros, which is Greek for joint. Itis as a suffix on any word means inflammation, so that arthritis means inflammation of the joint. And what it is in reality is the wearing away of cartilage. So take a chicken bone. We've all seen the white gristle on the end of a chicken bone. That's cartilage, and that is what wears down over time. Unfortunately, it doesn't always last a lifetime. And to use the tire analogy, you get a brand new tire, you got a big thick tread, and that gradually wears down over time. What we do when we do a knee replacement is it's more of a resurfacing procedure. We resurface that end of the bone, of the cartilage that has been worn down. We've been doing knee and hip replacements for decades, and in the case of a knee, we simply resurface the end of the bone. The part that goes over the thigh bone is generally made out of cobalt chrome. The implant that goes on the top of the tibia, the bone on the lower part of the knee, is generally made out of titanium. And the material that goes in between the two bones is made out of polyethylene. So when we put these parts in, we're actually removing part of the bone. We take out the very ends of each of these bones and replace them with an equal amount of metal. When we make those cuts, we've traditionally, for decades, made those cuts using what we call cutting jigs. They're actually devices that we implant on the skeleton, on the bones, that have what we call a cutting block that has a slot in it, and we set that cutting block to a certain angle, and that guides our saw blade to cut the end of the bone in a precise manner. There's been a development where we can make those cuts with greater precision. It's called a custom cutting block, and what's involved is one extra step prior to surgery, and that's to get an MRI, or sometimes a CT, CAT scan of the patient's knee. That gives us a digital image model of the patient's knee, and from that we're actually able to construct a custom cutting block that's designed for that patient's knee. The computer has designed this cutting slot to cut the bone, to make the bone cut at a very precise angle. The goal is to hopefully translate into a quicker recovery. So it's better for a number of points. It's less invasive. Generally, the time the patient's in the operating room is less. So it's enhanced our ability to, and our level of precision when we do knee replacement surgery.